Pause and be the first to know. This is the Comrade Show. The Comrade Show with Comrade Untitled live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show. The Comrade Show with Comrade Untitled live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show. The Comrade Show with Comrade Untitled live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show. The Comrade Show with Comrade Untitled live on Facebook.
Very good evening, good morning, good afternoon to you, depending on where you are joining us from. This is the Comrade Show, and my name is Comrade Lamte Ikmomusa. Today, we're having a program, a segment of the Comrade Show, and this segment is called Health and Relationship. And I've got some professionals, doctors, that are going to be helping us look at infertility and childlessness, particularly as it affects the black man. When I mean the black man, us as Africans. And so they're going to help us look at some of these issues, because the issue of infertility and childlessness is one matter that is highly under-discussed, and yet it's a matter that, if you look around, a lot of people close to us are suffering internally. And we thought that we could use this program to equally talk about these things, demystify some things, if you may, and of course expose some things about all of these issues, that some basic things that we may need to know that may be helpful to somebody. Along the line, we are going to entertain questions anytime they come, and we hope that you call in to ask the questions. But if you are joining me, please ensure that you share this broadcast, because it's going to be very interesting. I'm not alone. I have two doctors in the house, and I equally have a very close, colleague, of the Comrade Show, Musketeer. Two of us are not doctors, so we're just going to be like many of you out there watching us right now. But so we are going to be asking some of the basic questions, and we expect you to ask some of those peculiar questions that may, affect you or affect somebody that is close to you. But without much ado, let me quickly, bring on my co-host for this program today. It's not other but Dr. Tony Agboansebaife. Dr. Tony, please.
Thank you very much, Comrade Lamte Oriahi, and viewers of the Comrade Show. It's good to see you on a weekday. I'm really happy to be here as we discuss this very exciting topic, which is very, very germane to our lives as human beings and as people from ethnic minorities. Thank you all so much.
Yes, I equally have in the house. This time we are moving on to the other side. Those that are going to be lecturing us and telling us about infertility and childlessness. I have in the house Dr. Loretta Ogboroko. Dr. Loretta, please. We can hear you, ma'am.
Good evening, everyone. A Merry Christmas to all those celebrating out there, and good evening to everyone. Thank you, Comrade Oriahi and fellow comrade Dr. Agboansebaife. It's good to be here. Thank you.
Thank you very much, Dr. Loretta. We equally have, yes, another daughter in the house. This one, she's ready and willing to ensure that we get these things very clearly as much as possible. And let me quickly bring on board Dr. Edith Charles. Doctor, you're welcome.
Thank you very much, Comrade. Thank you for having me. Hello, viewers. It's going to be a nice outing, a nice session. So join us, invite your friends, and let's have a discussion. So I'm glad to be here.
Okay, we are going straight to the matter. Straight to the matter. Dr. Loretta, infertility, childlessness, a big problem. What do we need to know?
I think it will be good to start with the definitions. And I'm really excited that I'm sharing this discourse with my very good friend and a reservoir of medical, what should I call it now? Is it championing or awareness raising? Dr. Edie Charles. It's really nice to have you here. And I must commend your health gospel work. It's like second to none. But going straight into infertility and childlessness. What is the definition? We should start from there. We should know what it is. Infertility is defined by WHO as when a couple who have been cohabiting, that means they're in the same house, and they are having regular unprotected sexual intercourse, are unable to achieve a pregnancy within 1 year of cohabiting. So you can see it says a couple. Infertility is a couple disease. It's not one person's disorder. It's not the man's zone. It's not the woman's zone. You have to be a couple for it to happen. You must have regular unprotected intercourse. It's not the one you are married for 3 months. Recently, somebody called me. I've been married for 3 months. I'm not yet pregnant. I told her, go and wait out the remaining 9 months and have regular unprotected intercourse and just chill. Now, childlessness, on the other hand, there's a slight difference. You may be fertile and yet childless. So it's important we get that clear as well. So, for instance, if a woman keeps on having recurrent miscarriages and she's had like 6, that couple is not necessarily infertile, but they are childless because they've serially lost that pregnancy. If a couple decide that we just want to be married, we don't want children, they are childless, but they are not infertile. However, most times, infertility does overlap with childlessness. So I'll leave that here for now and let someone else have the floor.
Dr. Agmos, over to you. Do you have a question for Edie Charles, please?
Yeah, thank you very much, Comrade Lamte. Dr. Edie Charles, I know I've seen you a couple of your presentation on social media. You do a lot of awareness on health. But I want to ask you, Loretta has talked about the definitions of both infertility and childlessness. But you know where we come from, we are very religious and culturally savvy people. So I wanted to throw some light on the religious and cultural basis of infertility and the adjuncts that also come from culture.
Okay. Right, thank you very much. That's a very good question to ask. I mean, that's like one of the crux of the matter, because I think that, to me, religion or culture mixed with infertility when it comes to a couple really makes it really difficult, even for the specialists, to break through into the problem. If you go through our culture is that that despises not the couple but the woman that is said to be infertile. Our culture is that culture that would discriminate against the woman that is unable to get pregnant when she's married. We have a culture where people look down on the woman, not the couple, because she has been married for over a year and she hasn't got a child. we have a society, a culture where even within the umunna, which umunna is like a family, like the village group, where you have women come together, like the village women, where they can demote a woman and not make a woman to be part of the officials because she has infertility problem. And then this woman goes to the church, which is a religious place where she could get solace, where she thinks she could get some succor, where she would think that this is a church, this is somewhere that this is God is, where I will find love and support. But right there in that church, she's also being discriminated. She's also being looked down. They say to her that she's possessed. They say she's got some marine spirit. They say she's because the sins that she's committed in the past has made her not to be able to conceive. So it makes a woman with all this background history I'm giving, it makes a woman not, or the couple, not to look at infertility the way Dr. Loretta has talked about it, but to look at infertility in all the wrong places, like what sin did you commit? What did your father do? What have your mother done? Why is your case different? So everyone is looking at the woman, and I'm so glad today that Dr. Loretta has defined and made it stress the fact that infertility is a couple problem, not the woman problem. And if there's anything that anybody, any couple out there should get from this program is, we have a problem, not my wife is unable to give me a child, but me and my wife, we are unable to conceive. That is where we should start redefining this myth around infertility. I will stop there for now.
Thank you very much.
Thank you very much, madam.
Yeah.
Thank you so much. Dr. Loretta, I'm just going to come over to you quickly. Please, viewers, don't forget, if you have a question, the number is right there on the screen. 044-7438-229094. Ring in and, of course, ask your question. If you want to make a contribution, you could equally contribute. No problem about that. Dr. Loretta, this matter, there's no doubt about it. It's vast. Okay? And the attendant problem to this particular issue definitely is wide. There's no doubt about it. Let me quickly ask you, from a professional point of view, what are the basic causes of infertility?
I really want to thank my colleague because I want to believe that the target audience for this program are our brothers and sisters in Nigeria and on the entire African continent, as well as the Black and ethnic minority in our diaspora. So I think this is really timely. And Dr. Edie Charles, thank you, because many people go about saying marine spirits, not being born again, being in possession of some ancestral curse is the reason why a woman is not able to conceive, not the couple. And I'm really pleased that you said they look down on the woman. I mean, this is just that simplistic way of defining how our social cultural context actually makes people suffer because of lack of knowledge. So let's get some knowledge. Infertility can be primary or secondary. Primary is when a couple, a man and a woman, who are together after 1 year have not achieved pregnancy, but they have never ever achieved a pregnancy. So what does that mean? Either with themselves or with someone else. So that means that that man and that woman don't have a child somewhere else. The woman has never gotten pregnant and had an abortion. That is primary infertility. Now, secondary infertility is when either the man has a child from another person before, or the woman has a child from another person before, or both of them have achieved pregnancies but lost it, like maybe recurrent miscarriages. So that's a breakdown of how that happens. Now, with respect to the causes, it can be male factor, although most people in our sociocultural milieu believe that there's nothing like male factor infertility. But there is. It can be male factor, or it can be female factor, or it can be unexplained. And in some cases, it could be both male and female factors. Now, what do I mean? I'm really trying to break this down very simply. Male factors means the problem in that couple synergy causing the infertility is from the man. And science has found that there is about 40% causative male factors, 40% causing infertility. And then the female.
Sorry, let me get this right. What you're saying is that science has found out that, in the case of infertility, 40% are caused by men.
Male factors, yes, male factors.
So it's, issues are having to do with the men.
Yes, so to keep it simple, if 10 couples had infertility, 4 out of those 10 couples are likely to have their problems because of male factors from the man's side.
From the man's side.
Yeah.
So apparently the stigma around women within the African culture.
And let me show you, the other 40% is female side. So they are even sharing it equally from how science has seen it.
So how about the other 20%?
And the other 10 to 20% is unexplained.
Unexplained. Yeah.
Or both.
Excellent.
So our people really need to get this simple. I'm really trying to avoid the big words and keep it simple. So you can see that for anybody, anywhere, to think that this is, that woman not born, this woman not get belly, it's wrong. It is that woman and her husband have not been able to achieve a pregnancy. And sometimes you don't know, they may have, it's just that it's not been a live pregnancy up till term and they've not had a live baby. So they may have been having recurrent miscarriages as well. So when you now look at the male factors, what can predispose a man to having infertility? Again, we'll now break this down. We can break it down into small headings. So there can be problems that have been inherited, in which case these are rare, something like the Fragile X syndrome. And there can be problems that they were not inherited, but they are due to illnesses that happen maybe in childhood, something like mumps or itis, or they may be due to illnesses now happening in adulthood, e.g. sometimes something as common as diabetes. People don't know, but poorly uncontrolled diabetes, if you even ask men who have it, they'll tell you. Because naturally, every morning, men have erection most times. The first thing that will happen when a man starts having uncontrolled diabetes that is affecting his fertility is that the early morning tumescence, that's what we call that erection, is no longer present. It's not there.
So no, sorry, you are brought into a different matter
No,
now.
don't let me go. Let me just list it. We'll come back.
Okay.
Then you also have medications that people may be taking that may cause some of these problems. Some antipsychotics have been known to cause some of these problems. You can then have lifestyle.
Please break that antipsychotics down, please.
Antipsychotics means medicines that are used to treat mental health issues like depression, schizophrenia, especially schizophrenia, and some of these things. Now, you also could have a situation where lifestyle, and this is big on the scale. Many men don't know, but alcohol, smoking are the biggest enemies of male fertility. Weight gain, obesity does not help anyone. I can go into the pathophysiology, but it may take a while. But let me explain that of smoking, for instance. When we smoke, anybody smokes, you increase certain substances in your body. One of them is tar, the other one is CO, the other ones are free radicals. And all of these things go and they damage different things in the body. But especially they damage fast dividing cells. And that's what all these gametes are, the sperm and all of that. So all these free radicals go there and they just destroy the whole thing. Same thing with alcohol. Same thing with obesity. Then there are those boys, those men who go to the gym and they are doing well, but then they start taking steroids to build their muscles. That use of steroid, even though you have muscles and you look like Hogan, can actually cause male infertility. The other thing with lifestyle is, what do you do? Have we ever wondered why the testicles, where the sperm is produced, why did God and nature put it outside the body? It is because optimal sperm production is at the temperature outside your body. So if you begin to do anything that raises the temperature of that place, then there can be suboptimal production of sperm, or you produce sperm that is not optimal. An example is people who always wear tight clothing, long distance drivers. Putting your laptop persistently on your lap raises the temperature. Going for full body spa all the time and steaming, all of these things can cause the production of poor quality sperm in men. High contact sports like rugby, that will come under trauma. So have you had trauma to the testicles? Has anybody hit you there? Or were you playing football and in that hobby and that lifestyle, you had trauma to the testicles? Or were you fighting your wife and she used pistol, the wooden pando pistol, to hit the place? I'm going in detail to describe all this because you now see some men saying, I impregnated that my girlfriend 30 years ago. How can you now marry me and say that I am not fertile? It's me that did not make you pregnant. But what kind of life have you led in that 30 years? What has happened to you? You know, and we should be careful. Though erectile dysfunction, when the male organ, the phallus, the penis, does not stand and withstand the sexual process, it doesn't necessarily mean the man is infertile, but it could be a cause of infertility because you are not able to insert the penis into the vagina and get the sperm into the right place. Then we now go and look at structural abnormalities. That means, is there something wrong with the entire structure, the anatomy? How does the penis look? Sometimes in infertility clinic in those days, we used to measure the size of the balls. How big are they? How small are they? Have they been diseased in the past? Some children are born with things like hypospadias, where the opening of the penis is underneath the tip and not at the very tip of the glands. And in low resource economic countries, they are not fixed on time. And these children go on to become men. And it simply means that when they will ejaculate outside of the vagina. And they may not be able to then get things to the right place. So there are a whole lot of things that can cause male infertility. A whole lot. And we should not trivialize it at all. Now, I will leave this and go to the female side and also try and break it down. In the female side, and maybe I could have also done this with the male, but you can look at it as you have a system that works to bring an egg and a sperm together. If there is any blockade in that system, then obviously they won't come together. That's in the system. If there is a problem with production, that means the production of the egg or the production of the sperm, then there will also be a problem. Now, production is primarily governed by the higher centers, our brain, by special chemical substances in the body called hormones. So if there is a problem with the interplay of these hormones, then there will also be a problem. So you can see that there can be structural or anatomical problems, there can be physiologic problems in terms of the hormones, and then there can be other, you can group it under other. So structural, let's start with the structure of the womb and the tubes. Are they complete? Were they formed properly? And these can be problems in chromosomal abnormalities. There are some women, they have a blind ending vagina. There are some, the tubes are absent. There are some, there is no uterus. So these are things that you need to first of all find out. And I'll talk about ways of finding them out later. Then, along the line also, things could happen. You have an ovary, is nice, is doing its job, is producing the egg, but the tube has become blocked because of previous pelvic inflammatory disease like gonorrhea, like chlamydia. In men, gonorrhea is easily identifiable. Chlamydia, not so much, but in women, it's even worse because chlamydia is silent most times. It just goes there, destroys the tube, destroys everything. And at the end of the day, that tube, which is like a functional pipe, I call it a functional pipe because it has little fingers that the eyes do not see inside of it, that beat on and push the egg that is released by the ovary towards the sperm. All the fingers will be clumped because they've been damaged by those diseases. And the next thing you know, infections, is that it is blocked completely and the egg cannot pass and the woman cannot get the egg fertilized. Or in some cases, semi-damaged, semi-blocked, and you have ectopics. So you could also move on to the problem where there's a hormonal interplay. Every month, every woman is supposed to release an egg from the ovary. And this is governed by the hormones estrogen and progesterone and their interplay. So when we start at the beginning of the month, just visualize it. Your period has ended. It's a new cycle. The ovary starts to produce estrogen. That estrogen keeps going higher, and that gets another egg to start developing. And then it gets to a point where the higher centers, there's an interplay between the hormones there, the what we call follicle stimulating hormone and the luteinizing hormone. And then they trigger and say, oh, estrogen has reached a particular point. It then pushes them to say, release that egg. When they release that egg, progesterone then takes over. And if you are not fertilized by a sperm, then the lining of the womb sheds as menstruation. But in some of us women, many small eggs just start to form and all of them are releasing estrogen. Just releasing the estrogen. The estrogen then gets so high, it's not able to trigger that feedback that release only one of us. And so you have women.
Doctor, sorry, I just want so we can understand. You know, so they talk estrogen now. People are watching and like, what is estrogen? Can you break this?
Estrogen is the female hormone that allows the egg to start growing every month from the ovary, getting ready to be released. It's the female hormone that makes you nice and supple. It's the female hormone for when you are not pregnant. Every month, it just helps your egg to mature along with the follicle stimulating hormone. There are special chemicals, released by the ovary. But what
They are proteins. They are proteins. Yeah.
But what I'm saying is that in some of us women, the egg does not necessarily, is not one. Many of them start to grow and they produce more estrogen than normal. So you find some women, 3 months, no period. 4 months, 6 months, no period. The reason is because the feedback mechanism has been altered. Many eggs are in developmental phase, but not one single one becomes dominant to say, "Na me be leader, make them release me." No. So those kind of women are said to have polycystic ovarian syndrome, and that is one major cause of infertility because they
Come
don't
again. Polycystic ovarian syndrome.
syndrome. Yes. So
That means we equally have monocytic ovarian syndrome.
well, they have polycystic. That means many small eggs are forming, but they never get to maturity. And when it becomes, so that's just the ovary being polycystic. It becomes a syndrome when the hormones are tested and estrogen is very high and all the other hormones are checked, as well as they then have the manifestations of excessive hair, because that estrogen, as it said many, is now going to the fat tissues, which are like, they're like an industry. And those fat tissues will start using that estrogen, that female hormone. They will start converting it to male hormone. They'll start converting it to testosterone. So the next thing you find is that these kind of women, they don't have regular periods. They have hair, more hair, because the fat industry is changing estrogen to testosterone. So when you have all this complex, it is called polycystic ovarian syndrome. And one of the best ways to treat it, let me just say that quickly before I move on, is to lose weight. Struggle to lose weight. Remove that fat industry. That is why in treating infertility, always say try and get your BMI to at least below 30. Lose weight. So
yeah, Dr. Loretta, I want to ask you a question because you have said so many things in your answer to the question Lante asked you. And this is my question. Please don't laugh. It's very basic. You know, for a lot of men, you were talking about that early morning erection that men have and all that.
Yes.
I can relate to that as a man myself. So, but some men, because they have erection, even during the process of sexual intercourse, they have erection. So when it comes to this infertility issue, they will say, no. I'm okay. At least I do work yesterday. I do things. So how do we? Because we were trying to bring awareness in this matter. So what do you have to say to that?
Okay, this is a very good question, Dr. Agbons. Let me answer this and keep it really simple. So there's what you call erectile dysfunction. Erectile dysfunction is when a man cannot sometimes initiate or sometimes sustain an erection. Erection is when the penis is aroused, becomes turgid, and increases to at least thrice its normal size, 3 times its normal size. So that is an erection. So a dysfunction is in that process is when that cannot happen or that cannot be sustained. Some women say, go 1 minute man, those kind of words. And that sometimes means the man cannot even have orgasm and therefore cannot ejaculate and cannot release the products of ejaculation, which is the semen. Now that is erectile dysfunction, but that is not necessarily meaning that that man is infertile. The same way that if you keep having erection every day of your life and twice on Sunday, it doesn't mean that you are fertile. Fertility is what is the number, what is the structural morphology. When I say morphology, I mean the anatomy of the sperm. So let me explain what I mean. How many sperm cells are in your ejaculate? So when a man ejaculates, that fluid that comes out that people call semen is made up of a lot of things. There is sperm in it, there is prostatic fluid in it. So, but the core question we are asking in terms of fertility, when you go and do a seminal fluid analysis, is how many sperm do you have in a drop of that your semen? Now, even if you have the right numbers, how do they look? A proper sperm should have a head and a tail piece, and it should be forward moving. Now, does those do those sperm cells in that ejaculate, do they have a head and a tail piece, or they are just head, or they are just tail? Are they moving forward, or are they turning around in one place? Now, I can use some terms. Is there azoospermia? That means reduced sperm count. Is there a deformity in the sperm? Some have two heads when they should only have one, two tails when they should only have one, and they are not forward moving. So, my brother, you can be having all the erection in the world, and yet you are firing blanks. A good example.
So, just this one you talk, so I want to just follow up on that blank matter. now, are you trying to say, by what you're saying right now, like, it doesn't mean whether you'll be 5 minutes man, 1 hour man, 10 seconds man, it doesn't matter. You can be 10 seconds man and still be able to impregnate a woman. Is that what you're saying?
Yes, you can. You can. Depends. If you are able to, in that time of 10 seconds, achieve an orgasm and have semen poured into her, you can. You don't have to be a 1 hour man.
So invariably, there are so many 2 minutes, 1 minute men that have children. That's what you are saying.
Yes,
and there are many 1 hour men that have no children.
They may not have it because they may be firing blanks. And I was just going to give you an example.
Okay.
Imagine if growing up, a man had mumps orchitis. It's called mumps orchitis because mumps is from what the swelling here. Orchitis is that it affects the testicles.
Yes.
Yeah. And that child is now infertile, but that child does not have erectile dysfunction. And that child will be able to be maybe a 1 hour man if there's such a thing. But we in science, it is smiling. We know that there's no such thing. Okay? There's no 1 hour man anywhere in this world. You can quote me. And then this man will say, oh, I'm having sex, I'm fine, but he's firing blanks.
Mm-hmm.
There should be at least 15 million sperm per
ejaculate.
Yes, at least, in the very least. But some people don't have that. So
sorry, Dr. Loretta. This point is very important because there are lots of African men out there who will beat their chest and say, I have good erection. Why should they say I have a problem? It's very important. It's not really something, it's funny, but it's very important point that you can have good erection, and you can have orgasm, but the sperm you're producing is empty. It cannot fertilize an egg. So it's still important for you to get help. If both of you, husband and wife, couple, partner, living together, you are unable to achieve a pregnancy, do not be deceived to say, I'm the man, I've got good erection, she even knows that. And woman, don't be deceived if the man has good erection and you think that it is your problem, because the man can have these good erections, but is firing blank. It's very, very important, this point. This point is very important. I just wanted to stress it.
No, Dr. just let me just take you on and follow up on that before we come back to Loretta. Now, with the points you have made now, does it therefore mean that it does not matter how much muscle you have as a man that determines whether you can impregnate a woman?
It got nothing to do with muscle. It's got nothing to do with your style. That you said, I know women come after me. I know how to do it. This got nothing to do with your style or your muscle or your belt or look at me, a whole man like me. No. If you are cohabiting or married or in a partnership with a woman, and you have been together having regular sexual intercourse, and you have not achieved pregnancy, it is both of your problem until proven otherwise. Do not deceive yourself with your looks and with your style and with how many hours you're staying on top of the woman, because you might just be firing blank.
Dr. Agbo, before you come in, sir, I just want to follow up quickly on this one. Madam, you know, I had been told previously, this is not funny, that when a woman comes on top of a man, the woman is on top, okay? There are two things involved. Either the woman does not get pregnant or she can only give birth to female children. So it's always very important for the man to be on top. How do you respond to this when we are discussing infertility and childlessness?
Okay, is that for me? That should be for me.
Go ahead, madam.
Just to say that the normal sperm count should be between 40 million to about 300 million sperm per milliliter. Anything less than 15 million is tending towards low sperm count already. Now, people have this erroneous idea. They want to be God. They want to be nature. So they think that God just puts a cup there. Then when you ejaculate inside, if it's upside down, you just all pour out. And no, it doesn't work that way. What happens is that the whole female system, when I say system, reproductive organ, is actually working like a suction cup. And there is what we call mucus.
Madam, can you explain what you mean
When
by
I say
suction?
suction cup, it sucks things up. It sucks the right thing. It doesn't suck the one it doesn't need. And the right thing in terms of reproduction, which is what nature is all about. Nature wants to conceive. In fact, if you look at nature, the moment you have reproduced, the next thing is death. Look at the plants. Look at the animals. Look at us even. So nature is determined to achieve a pregnancy. That's how God and nature has made it. So it's a suction system. So when you ejaculate, even if the woman is on top, there are specific things that will facilitate the sperm. They swim. In fact, Usain Bolt is very slow. They swim like no man's business, and they swim in a forward motion. Can you see I'm doing my hand? That is how they swim. They have a tail that propels them. Think of the average sperm like a fish. And the one that gave birth to you and me was a hero. It outswam the rest and fertilized the egg of our mother from our father. So even if the woman is on top, by the side, to the left, under, it makes no difference, because the cervical mucus is such that it actually facilitates this sperm moving through it. Okay? And like I said, there's even been what you call the suction effect. The tubes, they're all beating as well. So please, these are myths that should be busted. If your wife enjoys sex by being on top of you, please don't deprive her that joy and say, oh, they said the man must be on top. Mama and Papa style. Who thou ep, you know? So
and being on top or below or by the side has nothing to do with the gender of the child.
Exactly.
So gender of the child is chromosome, XX or XY. If it is XX is females, XY is male.
And please, who carries the X and the Y? Please tell us.
Man.
So
whether the woman is squatting or bending or climbing, is what you are giving to her, is what you add to her X to give back to you. So
Okay,
whether
I have
a
question for Dr. Idi now. Doctor, this question has been on my mind. Because you in your introductory talk, you talked about the religion and culture. So I've done a little search as I wanted to know the exact, in the Bible, because a lot of us are Christians, but I don't know what is in the Quran. I cannot say for that. In Exodus chapter 23 and verse 26, one of the versions of the Bible said, no woman shall be barren in the land. I can't remember the other part of that Bible verse. So in our religiosity, a lot of women suffer because of this passage. So I want you to throw light on this matter, because this is one reason why some men will never go for tests,
Okay.
for scientific help, medical help.
I'm going to read from the Bible that you used to give reference, okay? Just quickly. Deuteronomy 7, I will read 13 and 14. And 13 says, I will read amplified so that it gives us more explanation. He will love you and bless you and multiply you. He will also bless the fruit of your womb and the fruit of your land, your grain and your new wine and your olive oil, the offspring of your cattle and the young of your flock, in the land which he swore to your fathers to give you. You shall be blessed above all peoples. There will be no male or female, barren, childless, infertile among you or among your cattle. There will be no male or female barren, not woman. The problem we have is the Bible interpretation in our society is absolutely wrong. We interpret the Bible to favor one side of people and then we leave the rest. The Bible is talking about no barren man or woman in the land. And barrenness, if you look at the dictionary, it's not just about giving birth to a child. Barrenness in your purpose, barrenness in your production. Loretta talked about that our humanity, we are created to reproduce and die. What are you reproducing? It's not just children. The Bible talks about it doesn't want you and me to be barren. We are sitting here, we are being productive. So even if I don't have a child, but I've got a purpose, I am not barren in the land. I am productive in the land. So when we read the Bible, let us get the meaning of the Bible, because they use it to confuse people. Bible is talking about no barren male or female, meaning you are created for more, to reproduce. It could be about your child, but more of reproducing yourself, your purpose, impacting your world. That is what it's talking about, the land, the cattle. So let's not focus on this woman. Let's read the Bible and understand it.
Thank you.
Thank you very much, madam. I think that is a lot. That makes a lot of sense. But I want to quickly follow up on that, madam. In our own traditional circle, okay, talking of the African traditional circle, okay, it is a huge problem. Well, I don't know if it still is, but there is this craze for, I must have a male child. We've seen people having 4 daughters, 3 daughters. They are still making effort to go for a male child. Are we considering people who have daughters as childless people?
Dr. Loretta.
Is this question for me?
Yes.
Well, I'm a girl. I am my father's daughter, and I have no apologies about that. I was raised and told I can be anything I want to be in this life. I don't need a man. I don't need a penis to achieve what I have to achieve. What I need is what lies between my 2 ears and not what lies between my legs. I have seen women rise to places of power and control the world. Angela Merkel is one of such. Even in Nigeria, we have women high flying. Ngozi Okonjo-Iweala is one of them. Edith Charles sat here is one of them. So I really do not understand when your IQ became directly proportional to the size of your sexual organ or which of them you have. So let's bust that myth today. Children are children. Male, female, they are children. And I'm glad you raised this up, because in our Black and ethnic minority, I have seen all sorts. I've seen in hospital in Britain here, people brought their whole church to the labor ward to come and pray, cast and bind, so that the woman who had had 4 previous cesarean sections and was having a 5th one, and it was also a girl, the baby can turn from girl to boy. I've also seen some Indians do interesting things because they also want boys. And I just think that this is a mentality that we need to really overhaul. A child is a child. If you have female children, you have children. What are people that don't have anyone at all? What's all this craze about male children anyway? I've also seen that in my own small experiment, female children take very good care of their parents. And there's absolutely nothing women cannot do. So I want to really finish the causes of infertility in the woman.
Yeah,
If
please.
I
I think we have
Yeah.
I want to believe this person is calling to contribute. Hello. Hello. Yeah, hello. Yes. Are you calling? I'm having a live program. Are you calling to contribute or ask a question? Go ahead, madam. What's your name and where are you calling from? I said, what's your name? What's your name? Okay, you are calling from UK and you are at work. Okay, go ahead. I can understand that.
I just want to ask Dr. Lorenta, can someone with a lining, can someone that have a lining uterus have a baby?
Lining uterus.
What's a lining?
What's the lining uterus?
What is a lining uterus?
Yeah, lining uterus.
What is a lining uterus, madam? We've lost the call. She said someone with a lining uterus, but she
Is
was
she
unable
trying
to
to
explain.
say the lining of the uterus?
I
That
think
means
Probably.
so. Probably it's lining of the
Probably.
uterus. Yeah.
all right. So I think possibly that was why I said let me finish the female causes of infertility. There are some other conditions like where you have fibroids, or where you have fibroids they are not cancers, they are just benign growths. When I say benign, they are just growths that can happen in the uterus, in the womb, and they are common in Black and African women. Black and African women, 3 in 5 will have fibroids in their lifetime, while Caucasians maybe 1 to 2. And sometimes they just coexist. We don't have any problem with them, but sometimes they can block the tubes and they can struggle for space with the baby, and all those can result in infertility.
Sorry, ma'am. Just why you are still on this. So what you are saying is that somebody can have fibroid and still be pregnant.
Oh yes, many of us have fibroids and we have children. Many of us are working with fibroids as women worldwide, and we don't know. And we are cool like that. So when you have fibroids, you need to first of all find out where is it, how big is it, how many are they? Are they affecting your quality of life? Is it making your period heavier? Is it causing infertility? Before you start jumping in to do much about it. And by the time we go into the menopause, the hormone that feeds it stops, the estrogen, and they just disappear by their own selves, or they get calcified. So they are not.
Sorry, while you are still on, N1, Esangbedo is saying on Facebook that maybe the woman was talking of prolapsed uterus.
Yeah, we'll answer her question.
Okay.
And then there is endometriosis, where you have the lining of the womb, which is the endometrium, being somewhere else. I don't know if that's what she was trying to say.
I think so.
But if that's it, with endometriosis, yes, it can be a cause of infertility, but it depends on when it is found, how severe it is, and all of that, and where it is. The other thing maybe she was trying to say, is she trying to say maybe a prolapsed womb lying outside or lying low, by which case we mean when the support of the womb is not as effective and it seems to drop down. That in itself should not cause infertility. But it can, in fact, too much fertility, having too many children can be a cause of prolapse in later life. So I don't know if she can call back so that we know exactly what she was trying to say. And I think on the final analysis as well, there are medications and there are lifestyles that can also predispose to infertility. Just like in men, smoking, alcohol, obesity can all cause infertility in women. And in terms of lifestyle, use of drugs, lack of exercise are things that can also predispose to infertility. having unprotected intercourse and making it commercial, or having multiple sexual partners can predispose one to pelvic inflammatory diseases in early life, and that can predispose to infertility as well. And sometimes having infection in the womb. I've seen women, they have one child, they then have infection following that delivery, the womb gets stuck, or they have unsafe abortion, the womb gets stuck, what we call uterine synechia or Asherman syndrome in some cases, and then they can't actually have children. So a lot of things could cause it. Temperature of the womb is not a factor in causing any problem in infertility in women. That myth needs to be busted. You cannot go and put a thermometer into the womb. You'll be saying what's the temperature of the womb.
The
So
womb has naturally got his own balance when it comes to the temperature. So you can't go and start altering things. And Dr. Loretta, thank you so much. Let me just bring this one maybe for you to highlight. There are a lot of Black women, a lot of our young women in the society now who, when they want to get married or they're going to meet a new man, they use chemicals, especially alkaline substances, to do what they call tightening of the vagina. So I want you to throw light, as a gynecologist, throw light into this aspect, because when they change the pH or the environment of that tract, what that can either stall the sperm from moving up, that can even block the sperm from going, and then we now go down the route of deliverance and causes, but we forget the cause, what we did to our vagina, just to show the man that I am a virgin. So they go and tighten. Even their mothers do it to them so that they will present the girl as being a virgin. I don't know what that means.
Dr. Edie Charles, thank you very much. I'm sure you see a lot of this damage in A&E, but I think as a gynecologist recently, after seeing a lot of women, and even being in groups, I saw what they were discussing. I had to write something on this. That slave queens should please leave their vagina alone so that they can have it to use for longer. Because what happens is when people are young, and because of lack of knowledge, they do a lot of things that result later in problems like infertility, like you mentioned. The vagina is a self-cleansing organ. Thank you, Edie Charles, for saying that. As a gynecologist, I can tell you that nature has made it in such a way that God made that place perfect. God particularly created the kind of pH. When we say pH, it means the acidity or the alkalinity of a place. He created the type of microorganisms that should be in that place so that they can create this pH he wants it to function at. Nature is so good that it doesn't allow any of these bacteria to outgrow themselves. It tries to create a balance. And it does this naturally. Then comes the wise slay queen. She then goes and gets, this vagina is not scenting enough. I don't like the smell coming from it. I need to make it scent is not a fine scent. It needs to smell like Obsession, Cerruti 1881. So they carry all sorts and begin to wash inside their vagina. There is no problem if you even get a simple wash. A simple wash. And just wash around where the pubic hair is and the labia. But I see people, they stick all sorts of things into their vagina. And what then happens? They distort the pH. Before you know, the bad bacteria start to multiply. And at the end of the day, the pH balance is changed. You remember I spoke earlier about cervical mucus that will help the sperm to move nicely. This is distorted. The sperm cannot move in a forward position anymore It cannot even pass through. Sometimes they corrode their own vaginas. They then have a lot of pain during sexual intercourse in later life. Sometimes they just introduce infection and they don't know, and it ascends. That means it goes up into the tubes. And before you know, they have endometritis, subclinical one. Endometritis is an infection of the womb itself, and it spreads to the tube, and their tubes are blocked for life, or if not blocked, they are functionally disfigured for life. And all of this can lead to infertility. Even in later life, you find that you cannot even enjoy the sex that you set out to enjoy by doing all of these things. So I would employ women today that when you use alum or anything to wash your vagina, what is happening is that you are stripping what we call the mucosa, the lining, which is supposed to be soft and moist and slimy. You are stripping it of all of that moisture, all of that sliminess. You are stripping it dry. And what the man is feeling as tightness is actually you drying up your body. If you truly want to tighten your vagina and use your vagina properly, then go and engage in pelvic floor exercises. Use the muscle. Don't destroy the skin over the muscle. That's a simple solution.
Okay. It's a very serious matter. Dr. Agbons, just before you come, you come on. This woman just sent a text message because she's at work, what she called. She said she was referring to endometrial hyperplasia.
Oh, endometrial hyperplasia.
Yeah.
Okay.
If that can cause infertility.
That is a precursor for cancer, not necessarily infertility.
Cancer of what?
Of the womb.
Oh, okay.
A precursor. Can you break that down?
A precursor means a forerunner. It means the cells are beginning to change. Now, let me break it down. Endometrial hyperplasia. Endometrium is the lining of the womb. Hyperplasia means hyper. That means the lining of the womb has divided and divided and divided. It's thick. It's beginning to thicken up, and it gets to a stage after thickening up, the cells start losing their arrangement. Thank you. They change. And it is when the cells start losing an arrangement that cancer begins to set in. When they are when it's hyperplasia, it means it's just built up, and it's thick. So that is why we say it could actually convert or lead to cancer of the womb. Most times, if you are over 40, 45 years going into the menopause and you're having unexplained bleeding, or you had the menopause and you have unexplained bleeding, please go see your gynecologist and have it checked out, because it may just be endometrial hyperplasia.
Okay. But whoever is suffering this must see a gynecologist as quickly as possible.
Very important. There are ways to manage it, but that will take us away from our current subject matter.
Okay.
And we need to stick to the subject matter.
Okay. Over to you, Dr. Agbons.
Yes, thank you very much, Dr. Loretta and Dr. Edie, for the enlightenment you are giving to us and all our viewers today. You can see the program is really trending. Please, if you are watching this program, please share it. So, Dr. Edie, I want to ask you, because I'm just looking at you on this society aspect of this issue. You know, if you look at our society today, not like the days of our grandparents, our mothers, and all that. Society is highly sexualized. Excuse me. It's highly sexualized now. And see a lot of young people, because of the sexual nature of society now, they use a lot of pills, IUCDs, and all these other contraceptive options that are available. Does this have an impact on infertility and childlessness in the future?
Thank you, Dr. Tony. That's a very good question. I mean, I think we have done a program before with Dr. Loretta on this subject. I think it was about teenage pregnancy, and we did advise young girls that if you want to become sexually active, you need to go the right way and get proper contraceptives. We practice in the United Kingdom, and here, I mean, from they call it something competent. So from the age of 13 or 14, a young girl is allowed to make a decision to say, I want contraceptives. And they go to the proper, through the proper route, and they are being assessed. They look at their risk factors and they recommend the contraceptive that is good for them. It is better, way better than a young girl going to hide and have a sexual intercourse and then get pregnant and then go through the traditional route or the back route to try and get rid of the pregnancy, which would then lead to infection, which would then lead to secondary infertility. So for this particular question, I would say if you are sexually active and you do not want pregnancy, instead of just going by the roadside and getting contraceptives, IUD, injections and whatever, go straight to a doctor or a gynecologist and sit with them, because for every contraceptive there are risk factors that might not let you use them. So there are some other ones that might be good for your own, like I always say person specific. It might be just specific for yourself. I am not of the opinion where religious bodies, because of hypocrisy, will not let young people, even young adults, to express themselves in terms of seeking contraceptives. People will say, oh, that's not the standard of the Bible. But then we have young people in these churches committing abortion in the wrong way and injuring themselves and causing more harm to themselves than if they had gone to have proper contraceptives. So I am of the opinion that people should get proper contraceptive if they want to have sexual activities. They should get proper, but not the one they hide behind. They go to the roadside and they give them all sorts. And somebody inserting IUD, is that person competent enough to do it? Is that person trained to do it? Is he putting in the right place? Because this can introduce infection, as Dr. Loretta said, into that tract where the whole sperm goes in, and then you would start having cervicitis or endometritis, and then you start blocking all your tubes. So religiously, people are looked down on if they hear in the churches that, oh, this young girl has contraceptive. They automatically look at the girl as being a prostitute. They automatically look at the girl as being of low moral standard. But we have the same people who have become holier than thou, who are committing abortion every month in the backyard and destroying their womb. And these are projected as holy, but the way original and saying, I know I need to protect myself, I need to get this. They look at them as being unholy and sinners. This is the hypocrisy that is going on in the society. This is why young people are not going to get right help, contraception, or even sexual health education, because even their mothers, even the people around them, their family, would look down on them and say, this one have started prostitution. But it's not. I mean, I don't know if I've answered your question, but I've not answered it the way you wanted me to answer it.
Dr. Eddie Charles, I will let myself in at this time, because I think I have the unapologetic reason and rights to. First of all, sex pays my bills. I'm a gynecologist and obstetrician. And on the side,
can you break that down?
Sex pays my bills.
Okay.
I'm a gynecologist and obstetrician, and on the side, I'm a sexologist.
Oh.
So what does that mean? That means that In my field and specialty in medicine and in other things I do, I can tell you authoritatively that sex sells. Sex is commercialized. Sex is the center focus of men and women in this world. The psychiatrists will tell you that there are three basic needs: food, shelter, and sex.
And sex.
So let's not deceive ourselves, comrades.
No, we are not. I mean, this is
Now, you asked a question that do the contraceptives affect people later and cause childlessness or infertility? And Dr. Edie Charles has actually answered that question in the societal context. Now, in the scientific context, I will say an explicit no. In fact, if you want to protect your fertility as a woman, please, 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 any frog you meet along the way that you are kissing, use barrier contraception to avoid pelvic inflammatory diseases, to avoid infections that can botch your reproductive life forever. Use barrier contraceptions to avoid unwanted pregnancies. That when you then go for unsafe abortion, you can destroy your reproductive organs forever. I did one of my dissertations in the University of Edinburgh. I did it in post-abortion complications in southern Nigeria. It involved me going to the tertiary institutions and seeking out the number of patients who had had complications from abortions and finding out how and why this arose. And one of the greatest things we found that swelled the numbers was unsafe backdoor abortions. The question is, who is doing all these abortions with the number of us that sit in mosques and sit in churches every day, every Sunday, every Friday? So sex is real, sex sells, sex feeds some of us, and as a people, we have to culturally begin to accept that and put measures in place to protect our children from infertility tomorrow. If a man has had gonorrhea, he's also likely to have things that can destroy his own sexual organs. Same thing with chlamydia. So using a barrier contraception is not only for women. HIV is still there. 38 million people are still infected worldwide. Forget that we now have antiretroviral drugs. So you have 1,001 reasons to use contraception. And apart from the barrier contraception, you have the intrauterine devices, the Mirena and the copper. You have the implants for the arm. You have the pills, the combined pills, and the progesterone-only pills. And of course, in terms of the barrier, you have the diaphragms, the cups, you have the condoms. And don't forget, you also have the vaginal ring and the patches. And there's the ultimate. You can go for sterilization, either male or female sterilization. I've just run through all of this. I know we are talking about infertility. But like Dr. Edie Charles said, you must see your gynecologist. Because whereas I will put a copper coil in a woman that has no fibroids, a copper coil in a woman with fibroids will make her bleed a lot more. So that woman will require a Mirena IUS. So, and how old are you? Do you have migraines? That will determine the kind of pills you can take. Okay, so you don't just go to the chemist and buy things and start swallowing them. If you have hairy body, you have pimples, do you know that there's a particular kind of pill that you should be taking? You shouldn't be taking what every other person is taking. I want every woman today to consider themselves, and every man as well, that they are fearfully and wonderfully made by God the Creator. And that anything they want to put in their body or any problem they have needs to be individualized and managed in a way that holistically takes them into cognizance, and they must put themselves at the center of their care. There is no need you want contraception Instead of going to a specialist in that field, you go to an orthopedic surgeon who does bones or a neurosurgeon. This is common in our countries, Nigeria, Kenya, Cameroon.
No, I think in Nigeria we just go to the medicine store. We call them chemists.
And buy.
Yeah.
That's
And
what
by
we do.
If that
those
chemist,
people,
if that
Dr.
chemist has a
Loreto,
proper,
you're going too far, because an orthopedic surgeon at least have been trained, and at least you will have some level of understanding.
Respect, yes.
I mean, we have chemists, roadside
Yeah.
shops now doing surgery in Nigeria, on the streets of Nigeria, doing surgery.
No regulation.
No regulation. We have young girls in these places, and when they have infection, they are in these places. They don't go to the hospital. And okay, funny enough, yes, they give them all sorts of antibiotics. They can be okay, and they leave and they say, I'm fine. Oh, I've got rid of that. But they forget that infection has gone in and ascended into the tubes, and down the line they get married, and then they start the process of infertility.
Yeah,
You
Doctor.
are very right, and you are very right. Sorry, Dr. Agbon. This is another angle to infertility, because when you now look at the management of infertility, you find that many people have gone to chemists and even done more harm than good.
Yeah.
Before they've actually come to the proper practitioners.
Yeah.
To have their infertility managed.
Yeah.
Yeah.
Dr. Agbons, over to you. I have two very important questions for Loretta.
Yeah,
over to you, Dr. Agbons.
Dr. Idichas, sorry, I just keep bringing questions your own way. Again, I'm looking at our society, and sorry, I'm taking you back. The blame of infertility and childlessness is still heavily put on the woman. What can we do about this? Because like Loretta have said in her definition, according to the WHO, he said it's a couple's disease. It's the man and the woman. And you went further to even say, even the Bible that the people have been quoting wrongly, it's actually also referred to the man and woman. So on this context now, what can be done, especially for you who are practitioners?
I think it's a very good question, and it's a very big problem with the society. But I think with any darkness, light will always outshine darkness. So when we are talking about this sort of myth and culture, I think the most important thing we need to do collectively as individuals, professionals like the Comrade Show, like yourselves, is to continue to create awareness, because as long as we bring light to darkness, eventually darkness will have to give way to light. It is a long-standing problem, for generations and generations. So to come down and erase this mindset is not a walk in the park. It's not going to be a one-day problem or a solution. We can sit here and we do 3-hour show. It's not even like a drop in the ocean, because we have people in the communities, in your state, Delta State, in my state, Akwa Ibom State, in the Yoruba land, Hausa, where they are not even allowed to, the young girls are not even allowed to access social media or phones. We have tribes where young people are not allowed to do anything. They are idolized as when you're a woman. So they have they can't access information. And then we have our grandparents, God bless them, our mothers in the villages who've grown up with this mindset, and they are transferring it to the next generation. Because how would you explain a mother-in-law, as soon as you get their son gets married, they even start counting from day one. They start looking at the woman's belly from day one. The day she comes with her husband to visit her, she's not answering the greeting the woman is greeting her. She's looking at the stomach and she's touching it and saying, anything in it, and beginning to put stress on the woman. And this on its own, and I think Dr. Loretta didn't mention this stress on its own would not even allow the poor woman to get pregnant, because from day one, you've already increased her stress level, and she's beginning to think, this one, they have started touching my stomach now. I have to, and she's putting pressure, and this pressure everywhere, and her friends will now say, when are we expecting? Bypassing. They say all these things directly or indirectly. And then they have what they call barren women's meeting in the church. How can you have barren women's meeting? What about barren men's meeting? What about barren men's fellowship? Barren woman fellow that are infertile, so that they come and pray together. Why are you single out women to have barren woman fellowship? And every Tuesday they come with their long faces, stress, all of come together, and even the prayer, they are crying throughout the session because they are depressed. And every Tuesday you bring them and you're pouring them out, they will never get pregnant. They will not get pregnant. We need to educate people. We need to be vocal. We need to tell them the truth, because only the truth will set us free from all this myth and culture and tradition.
Thank you very much, Madam. Loretta, I have two very quick questions for you, and I want you to tie them. Anyhow, they are probably not very related as such, but they are very important.
Yeah.
Somebody asked earlier, and I don't want to bypass that. How do you treat low sperm count, particularly in men?
Oh, that's an excellent question.
The second one is this. This is practical, okay? And I'm going to be very practical with you. I lived in Spain for a long time. I lived in Germany, okay? And of course, I had very strong encounter with so many of our Nigerian ladies. You know, a common trade in Europe by our women, you know, particularly in the recent past, is prostitution. And many of them have come out of it, settled, married, okay? Years have gone by, and some of them are struggling to have children and all of that. Now, can you say and affirm that prostitution can lead to infertility? And if so, what should they do?
All right. So your first question about low sperm count, that comes under the management of infertility. And the management of infertility can only happen when the couple have been investigated. And the investigations are such that, one, a very good history, knowing about them, is the starting point. Number two, you then ask for some investigations. And the first line investigation for men is seminal fluid analysis. For women, you have the hormone profile, the ultrasound scan, and then you go on. Then you now ascertain, after all this investigation, what is the possible cause of this infertility? If it's male, is it because of low sperm count? What has been the likely cause of that low sperm count? Is it because of an occlusion or because of poor production? Once you find that out, then you can then treat the likely cause. But I do know that one of the main ways to manage this is to start from lifestyle. Stop your alcohol, stop your drinking, reduce your weight, and we can begin to take some known antioxidant multivitamins and supplements. Vitamin E, C, and zinc are really good. And as far as you're getting genuine ones, your diet too, you overhaul. But for the actual cause, you need to see a professional, an infertility specialist, or a urologist, to manage what may be specifically wrong with that person. If you have habits like wearing tight pants, stop them. Everyday sauna baths, spas, and steaming, stop them. Your laptop should not be on your lap 24 hours of the day and 365 days of the year. So a lot of things. If you're a long distance driver, stop and take breaks. If you ride bicycles, wear the appropriate clothing. Don't wear the wrong clothing and grind your balls away.
For
Okay.
even bicycle.
Yes, so even bicycle. Oh. If you are a horse rider, self, you need the right saddle because you need to protect those balls. If you are a high impact contact sport person, you need to think twice. How do I wear protective clothing? And if you are using steroids, please stop it. If you have long-term chronic illnesses like diabetes or the rest, please go and get yourself top-notch management of the primary medical problem. So those are many ways. But in short, please see your specialist. Don't just go and start buying things off the counter. If you have erectile dysfunction, also see your specialist. Don't just keep swallowing Viagra because Viagra has a side effect, like Edith Charles will tell you, of heart failure and cardiac problems. Now, your other question: if a woman has been a prostitute, and just to add to the first question, that with couples with infertility, please see the specialists and let them guide you through, take your hand and guide you through the management for infertility. It is a long journey. You don't sometimes get results immediately, but please go to recognized management professionals, that do the right thing. I've seen some practice where they will put in IVF, they'll put embryo like 4, 5, and then the woman will die of pre-eclampsia and eclampsia. Anyway, that will be a matter for another day. Now, with respect to the second question, where you said, if I've been a prostitute, would that affect my fertility? The simple answer to you, Comrade Oriahi, is to remember my definition of infertility. My definition of infertility is not mine, it's from the WHO. Infertility is a couple disease or a couple condition. I don't like the word disease. It's a couple condition where people are not able to achieve a pregnancy after 1 year of cohabiting. So please, when you talk about prostitutes, remember that there are male prostitutes, okay? Remember that in Spain, there are those. When I was in Italy or when I went to visit, I saw men who told me that just the way women came to use their shentro to make money, that is how they too will use their penises to make money. So there have been male prostitutes as well. And the risk, every profession has a risk. It has an occupational hazard. Okay? So if one is a prostitute, obviously you are more exposed to sexual encounters. That makes you more exposed to picking up infections. And those infections may go undiagnosed. They may go not picked up, like chlamydia. Same thing with a man. If you keep sleeping with man A, man B, man C, same thing can happen. And let me tell people today, if you have one sexual partner, i.e., I went to Italy and I met man B, or I went to Spain and I met man B, but man B has slept with all the trolley and all the Igbahuans. Please forgive me. I had to just go to my language, my native language. But he has had multiple sexual partners. By extension, the moment you sleep with man B, you have had multiple sexual partners. Let's understand this thing. Let's get it clear.
No. This is your theory. I don't understand that.
It's not a theory. It's the fact. It's the fact. So if I am in a man's house, okay, and I am by myself, being a very good wife, okay, I know you think I'm shaking tables now, but it's the truth when it comes to medicine.
Please shake the table, please.
And then I am married to a man who is a lecturer, and his penis is in every single girl in Unibank, Uniport, Unilag, anywhere. My dear, automatically you are a prostitute. And yet you are married and in one man's house. Yes. Ask me why. Yes.
Break it down.
The reason is simple. It means that that man has put you at risk. And clinically, if you come to me in the scientific world and I am beginning to clerk you to find out the history of maybe a problem you have, I have to take all these things into cognizance.
There are
And
risk factors.
yes, they're all risk factors. If you come with HPV, if you come with cervical cancer, if you come with different things, chlamydia, blocked tubes, but yet you have been in one man's house, and it happens. I see it. I run it. I see these things. Okay? These things happen. It means that without you knowing it, you have been a prostitute, either by accident in your case, or some women who intentionally do their own by commission. So please, when you say some women in Spain, I want us to please take that back, because you don't even have to have been a professional. After all, let me tell you, Lamte, professional prostitutes don't necessarily have problems. It's the good girls who have problems. And I'm not joking. In my own small experiment, I have found that those professional prostitutes know what to do. It is those naive girls who are probably in one
the question I ask, really, I'm not trying to stigmatize any. It's just purely about us, really, to be honest. And whether we like it or not, it is a trade that is still highly prevalent. More people are coming from Africa to join the trade, and it's essential now that we are on air talking about these, that people are more empowered. You understand? I'm not asking anybody to stop prostitution if that's what they want to do, but now people must understand some of the attendant, risk or consequence that may be involved in the process. Because of a truth, there are people I know, lots and lots of them, okay, languishing as we speak. They are old timers in Europe. You understand what I'm saying now? They've been married for ages, no children, no child, as a matter of fact. Okay, now could it have been, like you've been explaining, that people have picked up, things here and there while they were hustling? You get
I think let me come in there. I think when it comes to our people that go to Europe for this trade, there are two sets of people that go to Europe for this trade. There are some that, as Dr. Loretta said, they are professionals. They know themselves to the tip. They have principles in their trade, and they protect their sexual health. Very important. I mean, some of them are even trained. But we have some of these other people, unfortunately, who go to Europe, and they have people who say, I want to have sex with you without any protection. And they give them higher money. They give them more money because they call it skin to skin. They are the ones that will say, no, I'm not doing it. But there are some other of our sisters or brothers, because of the money they hear, they would collect the money and do it. And now, from what Dr. Loreto explained, that person you've opened up to, maybe because of few euros on top of what you would have collected, gotten from protecting yourself, because the person has added some few euros because he wants or she wants skin to skin. Automatically, you have inherited or is transferred all history on you. So you are now at a higher having problems. And trade. Some of them do not have legal residency in these countries, so they cannot access good medical care. So when they have infection, most of them are still having herbs from Nigeria that they have imported to Europe, and they have it in their homes. This is confirmed. I'm not even stipulating. I'm not trying to say no. This is even in UK. We have. Go to different homes. You go to 10 Nigerian typical homes, they still have agbo in their lockers. They have it. They have herbal concoction that they bring to them from Africa. So you would say, oh, no, I'm in Europe, I have. No, they have it. So these young girls are not legal in this country. They are afraid of accessing healthcare. Some of them don't even know how to access healthcare. Remember, some of them are on used. So when they are man that treats them. It's man that gives them treatment, and they think they are okay. But over time, because they've had loads of STI and infections, they have caused irreparable damage to their reproductive system. And by the time they come out of the whole trade, get legal documents, and then finally get married, some of the tube, Dr. Loreto can explain to you, they will just tell them, you know what, it's better you do IVF because there's no way we can go through this. It's all calcified. We can't get through this. So the best way is IVF. So this is what we see. And I don't blame the young girls. It is the society that they have not been enlightened. They have not been taught. They are not educated. They do not have a full picture of the complications of what they are doing. They are just there to, oh, our fellow women are doing this. We can do skin to skin and make more money within 1 year. And they jump to it. But they then pack all these complications and it becomes a long-term problem. That's what I see from the question that you posed.
Thank you. Okay, Dr. Agbos, just go on.
Yeah, because I want to, this question is to Loretta. I want to ask Dr. Loretta, yeah, because the question has been in my heart about Dr. Idi just even went there now. So Dr. Loretta, we have seen we've been talking about this infertility and childlessness. They say there's no problem with our solution. And now, Dr. Idi just mentioned IVF. I wrote it down here, and I want to ask, where it has now become a case of this couple cannot have a child, what can they do to at least have a child?
Thank you.
As an O&G doctor, if this is your field, Dr. Idi as well, a doctor. So you people, let our people hear. Is it the end of the world because they cannot do it themselves and then they want a child? What can they do?
Absolutely.
Fantastic. It's not the end of the world. And then I'm coming back to that, but that question on whether infertility is directly proportional to having had a profession as a prostitute, I need to actually clarify that. I said there is a risk and a hazard with every profession. And it depends. I think what I was really trying to bring out there is, who is the prostitute? Who? Is it the woman who stands on the road every day? Is that what you think? And I'm trying to dispel that myth that some people think they are saints inside their own house, but by extension, they are prostitutes and they are exposed to the hazards of that game. Because like Dr. Idi pointed out, they are going to pick up infections. So if one party in the couple, in the relationship, as much as is not upholding the ethos of that union, then there is a problem. If one party has not in their past, so let's be careful. If a man has gone round everywhere and he has an infection and he meets a young woman, he can infect her, and tomorrow they can have problems with fertility. And yet that woman was also not a prostitute. So I just want us to get things in context. But definitely, anybody who is exposed to unprotected sexual intercourse is at higher risk of having infections that can lead to irreparable damage of their reproductive organs, like Edie Charles has pointed out. So use your tongue and count your teeth and find out where you are. And when I say no protection, I mean barrier contraception. Because it's not only the pregnancies or the unwanted pregnancies, you have the infections. With respect to the management of infertility, I had started it. Thank you, Dr. Agbons. And I talked about having the proper investigation, having the proper history. Then when you've done all your investigations, depending on what it is, there are many different types of assisted reproductive techniques. You can start from the very simple, oh, is it polycystic ovaries? You go in there, you can give her things like medications, metformin, to help her ovulate, Clomid, and this should be done by the specialists. You can go in and pop all of those cysts, something they call ovarian drilling. It sounds very big, but it's just popping the cysts in the ovaries. And I said that the first and foremost treatment starts from yourself. Overhaul your lifestyle. Then obviously you move into the assisted reproductive techniques, which is what I'm sure you want to hear. There's a very simple IUI, insemination. So you take a pipette, the man ejaculates and gives to you after masturbating. Yes, after masturbating, for the holy people. Sorry, he has to give us sperm.
I beg you, as you are getting through with this, I was going to ask you something on masturbation.
Yes.
Because,
so you must give us a sperm sample. How do you want us to get it? You have to do it and give it to us. And then we take a pipette and we drop it into the woman's vagina. So that's intrauterine insemination. You just drop it into the...
It can it work like that without...
Yes.
And those eggs will swim?
Yes, that is what you even would do for the kind of 1 minute men you've described. The people who can't sustain erection, but it's not as if they are infertile. And it's also the kind that you would do. You just make sure that you give more chances. So it's just very simple. That's basic. Then from IUI, you can also do that with donor sperm. So if a man has been firing blanks, yet his mother comes to insult his wife every day, then himself and his wife, they are very strong couple. They have now decided that, look, let's fool all these people. So they went to go and see the specialist, and the specialist now did and said, man, you are the one firing sperm. The man asked, okay, I will agree to have a donor. So they find someone that looks like the man, who donates the sperm, and then all you have to do is just take it and you drop in the woman.
Who gonna get picking?
The man.
The couple now.
The couple. Yeah, the couple.
What of the donor?
Right now in Britain, if you are a donor, the children now have a right to ask who was their
biological father.
Yeah. And so if you have donated to 50 couples, you may just find out that 50 children will be knocking in 50 years' time saying, oh, yeah, our father. Well, that's on our side.
But this one is not going to work for our. We never grow rich like that.
Well, people do it. I'm sorry to inform you, Mr. Comrade, that people do it in Nigeria.
Our people.
Yes, but the women just don't speak out. Women are very protective of their men. So they do it. They do it. But if a woman goes to do that kind of thing, they do it.
I listen, my brother.
I'm one in the profession. Yes, I was an associate at Women's Health and Action Research Center at work for many years.
So, but the man will come with the woman, both of them.
Yes, they do it. Sometimes the illegal ones are where the woman doesn't know. They will now not tell the woman that, look, your husband is the one firing blanks, and they connect with the man and they swap the sperm sample. So the man will masturbate, give a sample, but they swap it with someone else.
But the man will be in that case.
Yes.
The man will know. Yeah.
Codedly.
Yes.
If the man knows and the woman doesn't know, it's better.
Well, but it's a couple disease, Mr. Comrade. With due respect.
Well, sorry.
Both people
so what you are saying now is the opposite of surrogacy, Dr. Loretta.
Well, sort of. You could call it.
Because this one now, the man, a donor sperm. For the woman now, a donor of egg or carrier.
I will explain. I will explain surrogacy. Anyway, so that's simple. Then you have a situation where you take egg from the woman, you take sperm from the man, you put them together in a test tube. That's why the first people were called test tube babies. IVF, in vitro fertilization. It means out of the body and in a glass. Okay, in vitro. So that's the meaning of that.
In a petri dish.
In a petri dish. Okay, or in a test tube babies.
Yeah.
And that can work when anything is blocked. So if the passages are blocked, if the tube is blocked, if there is sperm inside the testicles, but the pathway is blocked, You go there, you take an egg, you take a sperm, you put them together, they are fertilized in the test tube, then you put it back in the woman's womb.
All these are through some what's it called, the operation or?
Yeah, they're not so difficult. They are, well, simple.
All these things you are explaining right now, do we do them in Nigeria?
Oh yes, oh yes.
Yeah.
Just so that our people should know that there are different
Nigerians
options.
have very good infertility clinics.
Clinics,
proper
yeah.
ones. The only problem I have is that they are poorly regulated. Okay, when I say poorly regulated, in some aspects, not in all, but they do get results. People even leave England and go to Nigeria to go and do infertility management.
Oh yeah.
So yes, they do
Well, that's
very
a good
well.
thing.
And that's because England is so regulated. England will not do IVF for a woman over 45, but you can do anything in Nigeria. You can do anything in other African countries.
Even at 80, you can have IVF.
Even in Spain. So you find that most times people in England will go to other European countries, get pregnant, and come back to the NHS to have the baby. Yes, Edith Charles, you are right. So that's that. Then you have the different kinds of IVF. Are you going to do ICSI, intracytoplasmic sperm injection? So that means that you get the egg, then you get the sperm, and then you wash it very well. Then you select.
What are you washing?
The sperm.
Okay.
Then you select the.
No, how do you wash sperm?
There are special ways of doing it. You select the viable ones. So remember that initially I told you that some people are firing blanks. So they may have oligospermia, and then they have a bit of sperm left in their testicles. So they go there, they get that little one. It's precious, like precious cargo. You now wash it, you now select the one that has one head, one tail that looks normal. And then you now use that to fertilize. So that's a bit more advanced to fertilize the egg. So all of this procedure, they take time. They take the use of special drugs, they take energy, they psychologically sapping. But eventually, if you follow the right routes, many people will conceive. Then there are those women who, for one reason or the other, cannot actually carry their own pregnancies. And Dr. Tony said something like that just now. Surrogacy then comes in as well, where assuming I cannot carry a pregnancy for one reason or the other, maybe something's happened, my womb's been taken out before or something. Edith Charles has a womb. I still have my eggs. So they take my eggs, yeah, they take my husband's sperm, they create the baby in the test tube. So that baby belongs to my husband and myself. And then they put it in Edie's womb. So Dr. Edie is just a vehicle, it's just a carrier, it's just a surrogate carrying that baby for us.
So who is the genuine mother of that baby?
I am the biological mother of that baby, but there are legal terms that need to be clarified. Okay, the person who delivers that baby, actually has the maternal rights to that baby. So it's actually Edith's child, but Edith will sign the documents that she's going to give me back my child. So biologically, I'm the mother, but it's actually by law.
Is it the sperm that defines the biology in it, or
no? The biology is the sperm and the egg.
If they analyze if they are checking the DNA of the child, it is Loretta's and the man that has the child.
So the carrier's DNA will not be there.
It won't be the surrogate.
No, Edie has no genetic material.
No.
Now, you have to be careful too. You have to be careful. Let me just say this. If Edie is married and she's my surrogate, her husband can claim that child.
That's why, I mean, when it comes to surrogacy, there are lots of legal stuff. There
Papers have to be signed and all that.
Papers have to be signed.
You know, jokingly, Destiny Oviebu on YouTube, he's watching on YouTube, you know, he's saying that, you know, such a child will be called in Nigeria assemblies in the UK. Assembled child.
The child is a child.
But I think, Dr. Rita, this surrogacy, look, because we're looking at this infertility and childlessness,
and the different options.
So like you are saying, the person who has carried the pregnancy has no genetic material in the baby.
Has no DNA at all.
So it's the DNA of the man and woman.
Yes.
Yeah, it's not a bad idea.
Just a carrier. She's just a container.
Just a bag.
Because he's carrying the child. Some people will say, "It's my child. I carried you in my womb." Yeah, she's just a carrier.
She's just a carrier.
Yeah.
And those children, let me state here that socio-culturally, people think IVF children are less of children. They are not. These children are children.
We shouldn't even know.
Every bit children. And
We
they
shouldn't
should
even know.
be said as such, please.
Yeah.
I know that socio-culturally, different cultures have the part of the assisted reproductive technology that they seem to be more attuned to, and different religious and social-cultural groups have the ones that they'll say, "Oh, this is acceptable. Oh, this is, oh, I don't want that one." But whatever you do and you have your child, please, your child is your child. There is also the option of adoption.
Okay. I just want to ask, the IVF children, do they grow normally like the other children when we say?
Very, very normal children.
That's all.
And I want to ask a question. I mean, this is to the viewers, people watching. Which is better? There are situations where the man wants to hide and hide and hide because it's not his problem, but he knows that it's either exospermic or he's oligospermic. He doesn't have any sperm. He knows he's done his test. He's hiding his test results from the woman. Now, he knows the wife's cycle. He drugs his wife. And he brings in his friend, which he calls a confidant friend, or they pay a young man who they think is active, and they drug the wife. The night he knows this period my wife has ovulation, to sleep with the woman, and the woman gets pregnant. Which is better? Because this is not regulated. Probably a signed document. I don't know.
Can that actually happen?
It happens.
For real?
Yes, it happens.
That is very bad.
It does.
Without
the woman's consent, isn't it?
Yes.
Yes, people do all sorts of things, from what she just described to selling babies and all sorts.
Yeah.
But this particular one, is it possible?
On the vulnerability of infertile and childless people. Couples themselves exploit themselves, even in this infertility and childlessness.
No, I just wanted to find out, is it possible, okay, that a woman, without her consent, her legs will be opened and the thing will enter, it will enter?
She's drunk or drugged.
Yeah, they've drugged her.
In an altered mental state.
They've drugged her. And she actually thinks she's pregnant for the husband, and they celebrate.
But she will enjoy the intercourse.
No, she won't even know. Somebody that is drugged, she won't know.
How will she enjoy it?
That is really bad.
This happens a lot.
Oh, yeah.
They even there's even the woman will even agree. Some of them, the woman will agree with the husband just to protect themselves from society, from family. And they will bring a man to their matrimonial home to come and impregnate the wife. And I've had cases where the man, after many years, come and tell this man, you know, this child is mine, and me, I've not got any children, so I want to lay claims. And a lot of problems have come out. So
because even if he's got children, at some point, because the blood is always working.
Blood is thicker than water.
This is the reason why I brought this aspect. This is the reason we have to do things the right way.
Absolutely.
Let's not condemn surrogacy or who owns the mother. If you go the legal way, you sign all the legal documents, you get your child and you have peace of mind.
Yeah.
If you want to do IVF, you go to the right place, you do all your documents, and you get your child, and you have peace of mind. All this kurukere waka, it brings a lot of complications.
Problems.
Yeah.
Let's not.
Thank you very much, Dr. Lata. We are coming to the end of the program, but I just want you to quickly talk about this. Too much masturbation, does it affect fertility?
Well,
Whether a man or woman, because this now one matter will be this masturbation matter now one matter will be saying.
First and foremost, what is masturbation? Masturbation is when people achieve sexual should I say enjoyment or orgasm now without actually having the sex with somebody else. So they have stimulated it by themselves. And the next question is, who does it? Men and women do it. Why do they do it? They want to have the same enjoyment. They think in fact, some people said that is the only time they have
proper enjoyment,
proper orgasmic release. And then your question is, does it cause harm? Especially, does it cause infertility and childlessness?
If it is too much.
The answer I will say to that question directly is a no. It will not cause infertility and it will not necessarily cause harm. Now, the indirect answer is that depending on what you use for masturbation, you can cause trauma to your own reproductive organs without knowing. I know of somebody who always used to masturbate with with a hole that he has fashioned into something, and that thing, the external aspect is hard. So each time he sticks his penis into the hole, it's fine, he gets his enjoyment. But he was always knocking his balls against the hard side. And that wasn't good. He was causing trauma to himself.
So it was hitting the wall of the hole.
Exactly. So it was causing trauma. So it was causing trauma to himself. And eventually he actually paid for that because yes, there was trauma to his testicles because he then got an infection, got infected and all of that. So it depends on what you are actually doing to your genitals. If you are doing, because if you are using for instance, if a woman is using a vibrator, by extension, it's a type of masturbation. And if it's a proper vibrator, maybe something like flamingo, bullet types, proper types, properly made ones, it shouldn't cause any harm, and she should still get her enjoyment. So it shouldn't even cause infertility, okay? So that's the scientific way and practical way to look at it. The religious people will tell you it's a sin, but my science tells me that there's no problem with it as far as you are not causing trauma to yourself.
Okay, what is the best way to masturbate that is safe enough?
That is on individual basis. It's like asking me the best way to have sex. That is entirely dependent on the partner.
I just know everything now.
Well, we do. You may have to go for some information.
No, when it comes like the masturbation, let me just share this. A lot of people masturbate. I don't have a problem with that. I have a problem when I'm in A&E and you come in with deodorant can that you've packed somewhere, and I have to actually.
If you have a problem, what would I say? When you have lacerated vagina.
with all this stuff. The height of what I've recovered.
A fractured penis.
Yeah, the height of what I've recovered is a slab, which I have to extract. Yes.
So,
Yeah.
for what?
From where, Dr. Idi? From where you recovered that?
From the woman's
Okay.
inside.
Okay. Yes. Okay.
I think one of the most interesting one I've had to recover is the cover of hairspray. So the woman didn't know it was there. She had sex. I think she said she was drunk. She had sex with her husband. And then later they came to hospital and she said that the man wanted to have sex with her 3 days later and he couldn't go past. What's happening? That was when they now came to the hospital and we now discovered that there was hairspray cover. How did it reach there? The sex before this sex, okay? She was drunk or high on something, and the man decided to use spray can to help him and left the cover in there.
Without knowing.
Yeah. I had to remove it.
Yeah. The problem is not for me.
This is not a black person, I must say.
Well,
the problem for me is not masturbation. Whether you masturbate or you don't masturbate, as Loretta said, it doesn't affect your fertility. But the modus operandi, how you go about this, your masturbation, is very important.
Yeah,
I think it's relevant.
Black people, white people, you'll be amazed at what people do during sexual intercourse. I must tell you today. You know, this is what I do for a living.
I'm very naive. That's why I'm like surprised at this.
Well, you may just be deceiving us because there is no act to find the mind's construction on the face, according to
anyhow.
That's a big quotation, Dr. Loretta.
Yes, that's my treatment. But I think, in essence, now that we are here and we are just about rounding off, I think it's essential, just for knowledge's sake, for people to avoid using, what's it called, spray, using different kinds of banana to masturbate. It's not right because they are causing and creating more problem for A&E. For doctors like Dr. I.D. Charles and stuff like that. So masturbate. That's why I was saying, what is the best way? Do it safely. I think you can easily just say that. Whatever you are using, make it safe. Ugbeba is out of the ordinary for some of us.
And sometimes these things cause lacerations and penile fracture. I've had a patient who he came to A&E and I was at A&E at the same time. They had to call the urologist at that time. He had penile fracture and he was masturbating when it happened. So let people not think it's only women who are doing this. He was masturbating and unfortunately his penis was fractured. I just think that people need to sort of find things that can dissipate energy too, apart from sex all the time. Even though sex feeds me, pays my bills and all of that, I've often told Dr. E.D. Charles that it's grossly overrated. There's a lot more to life than all of these. And if you want to enjoy something for a long time, why do you want to destroy the organ of enjoyment? It doesn't make sense to me. You're supposed to have your penis and your vagina lifelong. And you want to just finish using it in one day. You want to finish using it in 1 month. You want to do all the experiments. It doesn't make sense. And then down the line, you start struggling with things like infertility. Imagine if you have been masturbating half of your life in a particular way that has been damaging your testicles. You probably have oligospermia.
Absolutely.
And then a poor woman is going to come and suffer that as well. Hey,
I think for me, everything in life has to be balanced. There have to be moderation. It's not these people that sex every day. Some men say I have to do it every day. For me, when it's too much, it's abnormal. Things have to be done normally and just moderate so you can last long. Because at the end of the day, you need your body whole to last long. You need like we talk about having contraceptives for young girls, yes, but the things they expose themselves to, I mean, I'm not going to talk about quoting Bible and being religious. I talk about being moral and being able to look after yourself. So if you're young and you're exposing yourself so early to all this stuff, you will get infections you're not supposed to get and all that. But I'm not here talking about, oh, it will lead you to hell and not hell, because I don't know who God will judge and who God will not judge. But I'm here about your health and your own self, taking advantage, being protective of your health, of your sexual health.
Absolutely.
So whatever you want to do, you have to get the right education, you have to get awareness, ask questions before you embark on it. And the last thing I will say, it's not what works for Dr. Loretta that will work for me. That Dr. Loretta did IVF doesn't mean I need to do IVF. Or that she's had 4 children through she's conceived 4 and had 4 children, meaning I must conceive and have 4 children. So I will do everything possible to conceive. We are not the same. We are not born the same. We've got different DNA. Let us always treat ourselves uniquely as us. Me, I'm different. She's different. Her treatment is different from mine. Your treatment is what your situation is different from mine. Seek help for yourself, not what my friend said I should go. My friend went to that doctor for her problem, so I will go. It will not be the same problem. Even if you have the same diagnosis, it might not be the same cause of the problem. So seek help for yourself, uniquely for yourself. That's my advice today.
Thank you very much. Yes, just the last one, Dr. Loretta.
Charles Morogbe wrote and asked that how he doesn't understand how a surrogate's husband can lay claims to the children in surrogacy, since he is not the DNA or biological father. Surrogacy and its legal implications are very, very interesting. And I'm telling you that if a woman is married and you do not sign the documents properly, you must sign the documents properly. There is every step of the way what should be done. If you don't, then the husband of that woman can actually make claims to those children. So go and read the fine print, find out whenever that's why most times in Nigeria, people don't even want to do it. Find out whatever you are doing, find out the legal implications. As a last word on infertility and childlessness today, I want to talk about the often neglected option of adoption, especially in our own sociocultural context. Adoption is still an option. After all, the main fact that you are a biological father does not mean you understand fatherhood or motherhood or parenthood. So it is something still worth exploring for couples when all other options have been exhausted. But it must also be done via the right channels. Don't go baby buying in a bar. You know, you must do it legally and properly, but it's still an option. You don't have to be the one who is the biological producer of the sperm to be a proper father and understand the meaning of fatherhood or motherhood. And finally, on the last note, I think I will commend the Comrade Show, Dr. Edie Charles of Health Gospel, Dr. Tony Agbons, because these are some of the first and baby steps in the right direction. Breaking the myths and empowering people with knowledge, empowering our people with the right information, be they at home in our countries on the African continent or abroad in the diaspora as Black and ethnic minority subsets. It's important because knowledge, they say, is power. So please take your reproductive and sexual health seriously. And if in doubt, or if you come to crossroads, or if you have any problems, seek out the specialists. Thank you very much. My name is still Loretta Ogborooko. My background is obstetrics and gynecology. I have shared the stage today with my colleague whose background is primarily emergency medicine. I have degrees in public and research, public health, as well as clinical education and simulation. And the reason I have said all of this is because of some comments I have seen in the group. Is she a doctor? Who is she? Why is she talking on this topic? I want to tell you that I don't think there are people more qualified than myself and Dr. Edie Charles today to handle this topic, especially on their side. I'm also a sexologist. And primarily, we are human beings. We can't talk about what affects human beings. Thank you.
Thank you very much, Dr. Loretta. Thank you very much, Dr. Edie Charles, for your time. In fact, if we take the next 3 hours, I'm not sure that we're going to exist this subject matter. Because we spent over 2 hours, and the segment is alive. It's been born. It's called Health and Relationship Diary, and of course, viewers, we've been dealing with infertility and childlessness. And if you've been with us, you can agree with me that it's been a very beautiful day because we've had two very beautiful doctors coming to dissect this matter. And I'm sure that some of us have learned a thing or two, looking at this subject matter. And of course, this would not be possible today if not for the very important questions asked by my co-host. That's talking of Dr. Tony Agbanseva. And of course, I can tell you that, like I said earlier, this program is born, and from time to time we're going to be coming up, bringing some doctors here and there from everywhere to talk about some of these issues that are grossly under-discussed, so that we can be more empowered, we can be more enlightened, more directed, so that society can be better for it. Dr. Agbons, I want to say a very big thank you to you. Your last word for the people, sir.
Thank you, my brother. I appreciate you so much. Thank you, Dr. Edie Charles, for your cerebral talk on this show this evening. And of course, Dr. Loretta Oduware Ogboroko. Thank you so much, madam. I really enjoyed this show. And our viewers, I thank you all. Those that sent comments and sharing, you are all great. Have a nice weekend.
Dr. Edie Charles, your last word.
I want to say thank you, comrade. Thank you, Dr. Tony Agbons. I've just met you for the first time. And my sister, Dr. Loretta, I can't thank you enough. You're always brilliant and very articulate and intelligent when you are laying out your point. So thank you so much. It's been a very, very, I like such programs because we are educating our people. We are creating awareness, and you never know who is listening. Last 3 years when we did a program on about babies, there was a woman listening to the program, and she was actually in the process of, she's already paid part of the money for this procurement, I'll call it. But the program we did had helped her. She watched it and she just said, wait a minute, what's happening? This is exactly what is happening to me. And she actually stopped the process. She contacted me and we went through it. I said, go and do a pregnancy test. She discovered she wasn't pregnant. She discovered this was all a scam. And at the end of the day, she discovered she was under a scam. They would have given her another baby. So programs like this, I really, really feel happy about it. Thank you so much, guys, for inviting me, and I'm really grateful. Thank you, viewers, for watching. And what you can do for someone is share the video, tag someone, and just make someone watch it. That's all you can do to help someone. So thank you so much, everybody.
Thank you so much, my sister, Dr. Edith Charles. I hope that next time we'll call on you, you will oblige us. And of course, Dr. Loretta, just 1 minute last word.
Well done, comrade. Well done, Edie Charles. Well done, Dr. Agbons. But more importantly, I want to thank everyone out there watching on whatever media, Facebook, YouTube, WhatsApp, anywhere. I want to thank them for their time. And I want to still reiterate that our shared humanity is the true religion. So if you hear something that has informed you, educated you, you don't hoard it, you share it. That's the true religion. When you share and give of yourself and make sacrifices. So please share this link to people. Let us be better informed. And let us not fall into the old ways that has kept us in what some people call the dark continent. Let us take our candles and let us continue to light our world. Thank you.
You've heard it all. Let's take our candles and let's continue to light our world. So viewers, thank you very much. My name is Comrade Lamte Oriahi. It's been a Comrade Show and a segment that we call Health and Relationship Diary. We'll come your way again sometime soon. For the moment, I want to say Merry Christmas in advance and bye for now.
Make Comrade Show wave. Comrade Lamte Oriahi. Live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show.